with the mic. Good afternoon. This is a small presentation that we are offering through Skokie Institute of Allied Health and Technology. Our purpose here is to provide our upcoming students and prospects to let them know what type of programs and courses we offer at Skokie Institute. So a little bit about the institution. We are an online not-for-profit organization, and our purpose is to provide our students with career training. Skokie Institute of Allied Health and Technology, also called as SIAD, is also approved through WIOA. So the program that we have gotten approved through WIOA, which is Workforce Investment Opportunity Act, is medical billing and insurance specialist. Our next uh, registration starts April 16th, so we are registering for the spring term. This small webinar is one for our nutrition and wellness program. The purpose here is just to give an idea to the students what type of programs and what type of courses they will be learning when they enter the program. Our nutrition and wellness coach program, which is also known as the health coach or nutrition coach, wellness coach, or nutrition wellness health coach, is approved through National Association for Fitness Certification. Students, as soon as they graduate from the program, we will help them get uh, sit for the certification exam, and we will help them get certified through NAFC. Our tuition includes the certification as well as books. So this is a small webinar that we will be starting. This is from one of our courses known as Community and Nutrition. This is chapter 1, just giving an introduction. Just giving an introduction regarding what community nutrition and public health is. So you as a student will learn what is community nutrition. It's a modern and comprehensive profession that includes and is not limited to health, public nutrition, dietetics, nutrition, education, and medical nutrition therapy. So nutrition and health coach can actually counsel clients and give them diet training if they are going to, if they just need um, to look at the diet because they have a condition, if they would like to know more because they are improving their health. So depending on what their purpose is, health coaches and nutrition coaches can help you get through it. Community nutrition also deals with a variety of food and nutrition issues related to individual families and special groups that have a link to a place like residence, language, or culture. Public health comes in portion because public health, the main purpose is for disease prevention and health promotion. So community nutrition is also included in the in public health because it helps nutritionists, nutrition coaches, health coaches to become the voice of the community, help them by giving them diet and important health prevention methods. Concept of community basically is a social group which is determined by geographic boundaries. You can have members that interact with each other. You can function within a particular social structure, create norms, and also, for example, a community in Chicago. For example, the community in Chicago would be Rich is one community. Then you have Parkridge as a suburb, Glenview, Skokie as a suburb, and all of these are considered communities. A community is also demographic, for example, in age, gender, social class, or race. So if you're looking at a community, you can also look at a high school. For example, Niles North High School, Niles West High School. Students in that high school are considered a community because we are basing them on base of age, gender, social class, or in other words, demographic. Examples of common interest in a community would be members of a national professional organization. You would have Academy of Nutrition and Dietetics. They basically would include a professional organization that would look at themselves when they are looking at diet needs, members of church, disabled individuals that are scattered through a large city. So if you're looking at the city of Chicago, you can look at the whole city as one, or you can look at a region of the city. So maybe the north side of Chicago, West Ridge. Um, we can also look at the downtown area. All of those would be considered a community. Then it can also be it would also consider a specific people with specific health conditions. For example, if you're just looking for people who have diabetes, certain group of people who have hypertension, certain group of people who have breast cancer, mental illness, or we could just look at a specific demographic that would be teenage mothers or elderly people who are living in a community or a nursing home. So, in short, public health and nutrition come hand in hand. As a student in the health department, in the nutrition health program, you will also learn about how you help the individual in a community. So, community nutrition and dietetic prevention professionals are members of community and public health agencies responsible for nutrition services that emphasize community health promotion and disease prevention. They deal with needs of individuals in primary, secondary, and tertiary prevention. For example, if you're looking at a community that has diabetes, you can look at community in three ways. One that have type 2 diabetes and the age group, one that have type 1 diabetes and the age group, and one that have gestational diabetes. So that would be mothers who are diabetic and they are pregnant. They establish linkage with other professionals in education and human services, for example, childcare, social work, agency services to older persons, high schools, colleges, universities, community-based epidemiological researches. All of these come in handy and are actually a part of public health and a community nutrition. So that is why when we are studying about community and nutrition, we also talk in terms of public health. So public health basically is the science and art of preventing disease, prolonging life, promoting health through organized community effort. Public health is viewed as a scientific diagnosis and treatment of the community. Although it's not considered a treatment, but we discuss ways and methods that would help us to prolong a community and prolong the life of a community. And that also includes community nutrition. So if you're looking at a nutrition in a certain community and we see that they are lagging vitamins, certain vitamins, or they're lagging certain proteins in their diet, that would be considered public health, a part of public health. Because now what we are trying to do is making sure that community gets adequate nutrition or adequate protein, and where is that protein coming from, what type of diet they need to consume in order to get that food. So examples in the past would be scientists who actually discovered scurvy as a disease due to a lack of vitamin C, was able to do that because in a boat when he was going with sailors, he saw that being in the sea, they were not exposed to fruits, especially citrus fruits. And these ships and these sailors developed scurvy. And that's when he gave these sailors oranges and lemons and other than citrus fruit and noticed that the condition went away. The focus basically is on the community strength and resilience. So community strengths can be physiological, psychological, social, or spiritual. And these all include factors like education, we learn how to deal with nutrition de de deficiencies in a public or in a community. And we can do that through coping skills, we can do that through education. So education will be giving them more information regarding nutrition, support system, knowledge, communication skills, coherent belief system, fitness, ability to develop a supportive environment, and self-care skills. Community strengths can increase the nutrition knowledge of the community members, which can subsequently reduce the medical care and cost. So when we increase the knowledge and awareness of a community and we focus on these skills, and especially nutrition becomes a part of it, a lot of the diseases, a lot of the disorders that we find in our community can actually decrease and improve the quality of life. For example, another example before I conclude my webinar is heart disease. We now know that heart disease can be caused by sedentary lifestyle. Then it can also be caused if you have genetics, if you have a genetical predisposition to heart disease. Also, if you smoke, if you eat a lot of fat in diet, all of these contribute to heart disease. So now, in order as a community or as a health coach, we have clients who are we dealing with a community that has high rate of heart disease, and we would then focus on their nutrition, give them information on what diets to use and consume in order to uh, reduce their occurrence of heart disease, improve their lifestyle, and their lifestyle would be improved through environmental. We would coach them, and we would also train them and also educate them on the fact that they cannot risk factors that can be controlled, which is smoking, and then also increase the fact that they need to exercise. So we, as a coach, would then now train them and then coach them in order to improve their lifestyle in different methods. So this is where a health coach or a community nutrition coach comes in, because they train clients, they coach the clients in helping them to improve their lifestyle and increase their sustenance of living. Also, while they increase their lifestyle, their sustenance of living, they also improve and decrease the prevalence of getting different conditions or diseases. I apologize for me coughing while I was hosting the webinar. I have a bad cold. The purpose of this webinar was to let everyone know that our institution, Skokie Institute of Allied Health and Technology, has ongoing spring um, registration. Our spring classes are starting April 16. Right now, we have a promotion that if you register before April 6th for any of our programs, you get 40% of tuition and you get a free tablet. Books, certification fees, everything is included in our tuition. We are a student-centered institution, and we help and guide our students on their way once they enter our institution to until they graduate. Our website is http://www.siaht.org. You can email us for more information, info@s4samiaht.org, info@siat.org. This webinar will be available on our YouTube channel and also uploaded on our social media channel. I hope everybody enjoyed this webinar and gained some information regarding it.